Hi everyone, welcome back to this short tutorial on glucagon-like peptide 1 agonist from ilovepharmacology, or it is also called as GLP-1 agonists. So what is the action of glucagon-like peptide 1 agonist? So basically this GLP-1 agonist will going to increase the insulin secretion. Apart from that, it also suppresses the glucagon secretion and also it slows the gastric emptying, thereby the absorption of the glucose will be delayed. So finally, ultimately, through this three process, by increasing insulin secretion, by suppressing glucagon secretion, by slowing the gastric emptying process, you are going to lower the blood glucose levels, especially after meals hyperglycemia, that is the postprandial hyperglycemia risk will be reduced. So again, the action is somewhat similar to sulfonylureas because it also increases the insulin secretion. So what are the examples for GLP-1 agonist? We have exenatide, we have liraglutide, we have lexisenatide, we have dulaglutide, and we have a albliglutide. So coming to the improper specific mechanism of action of GLP-1 agonist. So once the food is ingested, what happens is in the gut, especially the ileum and the colon, has got a specific type of cell called as L cells, which are responsible for secretion of the GLP-1. So whenever there is a release of the gastric inhibitory peptide and the glucagon-like peptide 1, usually these are released in response to the ingested food, and they are the early stimulus for the release of the insulin secretion even before the absorbed glucose or the digested products reaches the islet cells of the portal cells to stimulate the pancreatic beta cells. Even before the stimulation of the pancreatic beta cells by the absorbed glucose, the released gastric inhibitory polypeptide and GLP-1 in response to the ingested food is responsible for secretion of the insulin. So ultimately what happens is they stimulate the insulin secretion. So along with that, GLP-1 also inhibit the pancreatic glucagon secretion, and also it slows the rate of absorption of digested food by reducing the gastric emptying rate or the time. And they are implicated in control of food intake via appetite, decreasing the appetite, and they increases the satiety level very quickly. So what are the uses of GLP-1 agonist? They are important drug which are used nowadays in treatment of type 2 diabetes mellitus in combination with metformin and glitazone. And drug liraglutide has been approved for the treatment of obesity as it decreases the appetite as well as the more quickly it increases the satiety levels. When we consider a off-lives, we have exenatide which acts for 2.4 hours, liraglutide acts for 13 hours, lexisenatide acts for 3 hours, abliglutide acts for 5 days, and dulaglutide acts for 4.5 days. Whereas exenatide, liraglutide, and lexisenatide they are acting in hours, whereas albliglutide and dulaglutide they are acting in days. So usually they are administered through subcutaneous injection, either a daily or a weekly dose. Because of the longer acting off life, the albliglutide and dulaglutide are given weekly once because of their long duration of action. So the GLP-1 analogs can cause side effects, that is GI related side effects like nausea, diarrhea. Specifically, it can cause acute pancreatitis. Since it decreases the appetite level, it can cause rapid weight loss. That's why the liraglutide has been approved for treatment of obesity, and they can cause hypoglycemia as usual as that of the other group of hypoglycemic agents. So we should be careful whenever we are using the GLP-1 agonist, especially in combination with sulfonylureas, because sulfonylureas are the dangerous drug in producing frequent hypoglycemic episodes. So this was about the GLP-1 agonist. Thank you.